about a woman's life, her medical needs change, and here at New York Methodist Hospital, we're prepared to meet those needs. In this video, you'll learn how we treat fertility problems and high-risk pregnancies. We'll also tour neonatal and pediatric intensive care units. Plus, we'll meet some of the pediatricians who help keep Brooklyn's children healthy. At New York Methodist, we care for women of every age. In addition to our obstetrics and prenatal services, we offer women relief from the symptoms of premenstrual syndrome and menopause. Plus, we provide early screenings and advanced treatment for breast, cervical, and ovarian diseases. For conditions like uterine fibroids and pelvic organ disorders, we have minimally invasive procedures that have short recovery times with relatively little discomfort. And for couples having difficulty becoming pregnant, we're here to help with award-winning fertility specialists, genetic counselors, and high-risk pregnancy experts. Park Slope resident Jennifer Friedland has had first-hand experience with many of the services New York Methodist offers women and children. Eager to start a family, Jennifer and her husband Stephen soon realized it would not be easy for them to get pregnant. The couple turned to the resources offered at New York Methodist Hospital's Fertility Institute, headed by Doctors George and Alex Kofinas.
We had started trying to conceive, and we spent about 6 months trying without any intervention, and I had turned 35, and it wasn't working, so I decided to go to see a fertility doctor. Then I came across Dr. Kofinas and realized he was associated with Methodist, and I kind of liked that he had a hospital affiliation.
Dr. George Kofinas evaluated the couple's case.
Our quest to conquer the problem and solve it and give the couple a baby, or more than one, and they build a family. And that creates a very long-lasting bond.
Dr. Kofinas and his staff were really great because I really had the sense with them that they were being very honest. I grew to trust them.
For Jennifer and Stephen, in vitro fertilization was recommended, and the second attempt was successful.
With their encouragement, I kept trying, and it did work. And I was pregnant with twins. And so immediately, the nurse calls to say, "You're pregnant, and now you're done with us. You're going across the hall to Dr. Alex Kofinas."
Jennifer's pregnancy was not an easy one, so Dr. Alex Kofinas, an obstetrician specializing in high-risk pregnancies, closely guided her through the process.
Then she was very well prepared to go through the process of a high-risk pregnancy. When a patient comes in, here they see the completeness of the service, they see the professionalism, they see the caring. This is a highly technological, sophisticated medical office, and I'm accessible to my babies and patients 24 hours a day, 7 days a week, globally.
During all of this time, Dr. Kofinas was always reachable. He was great, and his staff was really great.
The staff understands that the patient is what we care about. And of course, the goal of the patient is our goal.
Many women using fertility treatments will then experience a high-risk pregnancy. However, even a naturally conceived pregnancy could be termed high risk. Our specialists in this area counsel women through pre-existing medical conditions such as high blood pressure and diabetes, as well as complications that could develop as a result of pregnancy. Under careful monitoring and care, Jennifer was able to carry her babies almost to term when she entered New York Methodist Hospital for labor and delivery.
Dr. Kofinas was wonderful. He just really walked me through what would happen, what was going on, and what the various possibilities were.
Should your baby be delivered through cesarean section, our anesthesiologists, obstetricians, and surgical staff have the expertise to guide you through the process with warmth and compassion.
Sometimes women can feel a sense of failure if they end up with a cesarean section versus a natural birth. And many times it's not their fault, it's just sometimes it could be the baby is too large, or it's in an unusual position, or it's coming buttocks first, or there's just fetal distress and you have to deliver the baby in the way that's best for the baby and mother. New York Methodist is unique. It really is like a large family gathered together just to get the best result possible for a woman.
So I went into labor at 32 weeks and 3 days. And that morning I had a C-section and gave birth to my son and daughter. My son is Benjamin, my daughter is Noah. And they were very little. My son was 3 pounds 5 ounces, and my daughter was 3 pounds 6 ounces.
When babies arrive prematurely, they may need to spend time in our neonatal intensive care unit, or NICU. Jennifer's twins were admitted to the NICU immediately after their birth.
During the time that my children were in the NICU, my daughter was there for 4 weeks and my son was there for 5, I felt like the care that they got and that I got was really phenomenal.
When they're first admitted, we go through all the equipment that the baby is using, such as incubators, the warmers, and make the parents familiar with all the technologies that the baby is receiving. After the first few days, we feel the parents are very comfortable with not only, handling the babies through the incubators, but when they're stable, even being able to open the incubators and taking the babies out themselves.
Being that they weren't expecting usually a preterm baby kind of throws their life in a little bit of a haywire. This allows them kind of get a little test run before they go home, since they're here in an environment where it's a little bit more controlled before they get home, puts them a little bit more at ease, and you find that they're doing just fine at home after that.
I would say better than 95% of our babies end up on breastfeedings, including the small prematures, and we have lactation consultants who advise the mothers and encourage them to pump and how to freeze the milk.
Jennifer recently returned to the NICU to reminisce with Dr. Gudavali, who supervised Benjamin and Noah's care.
I certainly remember the first moment coming in and seeing them and them being so small, and then over time learning about their condition and always having the doctors and the nurses being available to answer questions, even though you were asked the questions by a million parents a million times before, but never feeling like I was the millionth person, and learning how to care for them, diaper them, and take their temperature and deal with their little bodies.
Obviously, in the beginning, she was nervous about the babies. By the time they went home, she was very comfortable.
The nurses and the doctors were just great. You really got the sense that they loved these babies and they were doing everything they could to help them get out of the NICU as fast as possible.
It definitely is the most rewarding to have families come back and visit us, and not only that, but to see that the babies are doing well.
And here are Benji and Noah today, visiting with the doctors who cared for them in the NICU. The feisty duo are healthy and happy toddlers, eager to explore and rearrange their surroundings while never straying too far away from mom. As you can see, the busy pair keeps mom on her toes.
I mean, for me, as a Park Slope resident, after I had this experience, I was always surprised to hear that people had delivered in Manhattan. I mean, between the IVF and the NICU, I spent countless hours here. And if I had to spend 2 hours a day commuting on top of that, it would have been impossible.
Jennifer chose to continue her children's health care with New York Methodist by selecting Dr. Bialik as the twins' pediatrician.
I called Dr. Bialik's office because he was affiliated with Methodist. Came in that day, I think later that day, to the NICU to visit the babies, and he had already been in to see them. I felt really good at somebody was taking such an interest.
In pediatrics in general, what you need to look is at personality, I think, the first thing. And knowledge is important too, and approach to the patient is important, but the personality is probably the first one. If it clicks with you, that's the way to go.